Jack and Mikhail.
So our presentation is on poverty caused by healthcare in the Bay Area.
So why did we choose healthcare? Well, we saw how much lack of healthcare can affect people and how much it really does affect people in poverty, even around here. And we really were interested in the downward spiral, how somebody who doesn't have healthcare can just break their arm or something and then their whole life just gets flipped upside down. And it also seemed like it could really affect people's lives.
So what is poverty like? It's really not knowing when you're going to get your next meal, if you're going to get it. No, there's no stability. You don't have a stable job, if you even have a job. It's like being stuck in a black hole, according to Ann Valdez, who was once in poverty. And you can't get some things like housing and jobs due to being in poverty. You won't have enough job experience for some jobs. You won't have the education for some jobs. You won't have the money for houses.
So what causes poverty? Almost anything can really lead to poverty. So like if you get sick or you break your arm or something like that, and you can't pay the medical bills or you can't pay to fix that, and then you're out of your job for a long time, and then you don't have the income that you'd normally have, and then you're in poverty. If you lose your job, you get fired for some reason, you again don't have your source of income, and you're in poverty. If you have an unexpected child, children are really expensive, so that can put you in poverty. And natural disasters can also put you into poverty, because like if there's a tornado or a hurricane, your house can be destroyed, your car can be destroyed. If you don't have a car, you can't get to work, you get fired, the spiral.
So what's healthcare? It's diagnosing, treating, and curing patients. Companies employing people in poverty often don't provide the healthcare that they need. So if they're in a car crash or they just get sick, they usually can't pay for it. And providing a health coverage costs an average of $9,300 a year per employee. So you can see why a lot of small businesses won't be able to provide it for their employees. Healthcare is very expensive if a company doesn't provide it for you. And the U.S. spends $8,233 per year per person. We spend the most out of any other nation per person, or one of the most.
So what does healthcare actually cover? Well, it covers trips to the emergency room, so if like you get hurt and you have to go to the emergency room. And without healthcare, the average amount of money that costs is $1,233, according to the Washington Post. It covers being hospitalized, like if you have surgery and you have to stay in the hospital. It covers that. It covers care for babies before and after they're born, so maternity care. And all of these things can get very expensive if you don't have health care. It also will help pay for prescription drugs, and that's a really big thing because if you have a condition that could stop you from working, and you need drugs to let you keep working, and then you can't buy those, then you can't work, and then again, the whole cycle of poverty. And it also helps with pediatric services, which is like doctor's appointments for younger kids, like under 18.
So poverty in the Bay Area. There's 4,000 recorded homeless people in San Francisco alone. There's probably a lot larger number than that. There's 1.3 million people officially below the poverty line, and you need $29.83 an hour to afford a one-bedroom apartment in San Francisco. And it's not even in a good neighborhood or anything, it's bare minimum. And the minimum wage is 3 times less than that, it's $10 an hour. And in 2012, 46% of adults aged 19 to 64 didn't have health care, as reported by Commonwealth Fund Network, so very large amount of them unprotected. And as you can see from this graph, this is the monthly expenses for a family of 3. Housing is a huge part of it. Childcare, which, if you remember, was also covered by healthcare and food, or some of the biggest ones here. Healthcare, they didn't spend that much on it, so very dangerous for them if they get in some accident.
So why does lack of healthcare, and how does lack of healthcare actually cause poverty? Like I said before, if you have an unexpected illness or injury, it can really throw your life off track. Without healthcare, a broken bone can cost more than $2,500. Without healthcare, it can cost way more than that too. And it will quickly spiral. Like you break your bone, then you lose your job, you lose your car, you lose your house, you might lose your kid because you can't provide a healthy and stable environment for them. And then you're out on the streets, you don't have a job, and you still might be sick or hurt. About half the personal bankruptcies around here are due to medical expenses, so that's somebody breaking their arm and then they don't have any money, so they have to declare bankruptcy.
So, what we do around here to give people poverty, we have things on national level, the Affordable Care Act or Obamacare, Medi-Cal, and clinics like Hubbard, California. And Medi-Cal, basically, if you're not familiar with it, it provides health care, especially for young people in California who can't afford it, so it protects a lot of children who might get sick or injured. And clinics like Hubbard, California, on a more local level, we also have a lot of free or cheaper ways for people in poverty to get healthcare.
So we interviewed this lady named Kathleen Alexander. She worked for the Ravenswood Family Health Center, and we asked her a few questions about healthcare and poverty and how they connect. And one of the main points she said is how much people in poverty neglect dental hygiene. They just push it off and think it's not important and stuff, and they're just like, oh, well, I need my money for food and stuff, but really, it's very important, and eventually, if they don't tend to it for long enough, it will get out of control, and they'll have even worse things to deal with, so their bills can go way up because their teeth are rotten, and then they can't eat and stuff. She said that rich business owners really need to spend some of their huge multi-digit salaries on getting their employees health care. She said that it's kind of ridiculous that these CEOs are making millions and millions of dollars, and some of their employees are actually below the poverty line. And she said that one of the real reasons why a lot of people in poverty stay in poverty is because they're very proud and independent. They think they should get through this alone, and they think they will get through it alone, and so they never go to things like Medi-Cal and stuff to try to get the help that they need to get out of poverty.
Why don't you grab the problem solver? So for our problem solver, when we learned from Kathleen that dental care was such a big problem and many people were unaware of it, we decided we had to do something, and we created a pamphlet and a bag of dental products. And basically what the pamphlet did is it explained the basics of oral hygiene and how important it is to people, and how to properly floss and brush your teeth and when to do it. And then also in the bag, we have mouthwash, floss, toothbrush, and toothpaste, so they can get started easily. Start protecting their teeth.
Thank you.
Yeah.